Good evening, everybody. My name is Matthew Dunn. I'm a physical therapy student at the University of Cincinnati, just finishing up my second year. And today I'm going to talk to you guys a little bit about battlefield acupuncture. So welcome to my TED Talk. First, I want to explain my general goals for this talk. I actually have three for you guys in this presentation. The first is to broadly understand central sensitization as a cause of pain outside of just strictly tissue damage. The second is to explain how battlefield acupuncture, which we'll abbreviate BFA for this presentation, is performed and some of its pros and cons. And the third will be to understand the need for new innovative pain relieving techniques and the benefits of trying BFA as it relates to these techniques. So first, you're probably wondering, what is battlefield acupuncture? Well, BFA is the form of acupuncture that involves the insertion of needles into the ear to reduce how the central nervous system processes long-term pain. So acupuncture in general is defined as placing needles at certain points in the body called acupoints. And this type of acupuncture is actually performed in the auricle, which is another fancy name for the ear. So we're placing these needles into different places in the ear that have many different proposed mechanisms of how they're actually reducing the person's pain. The goal of BFA is to treat pain lasting more than 3 months. So at this point, we should define chronic pain. You'll find many different time frames on chronic pain throughout the literature, but for this presentation, we're going to say anything more than 3 months, whereas acute would be a shorter, possibly more intense, maybe not, pain that lasts for a shorter period of time and typically goes away and the patient sees no symptoms afterwards. But battlefield acupuncture is designed to treat chronic pain and reduce the need for pain medications and other potentially harmful treatments that may have side effects, they may cause addiction, and just contribute to the opioid epidemic that we're currently experiencing in our country. So if you guys can imagine different places in the ear corresponding to different parts within your body, these needles are being placed into the ear and correlate to different parts of your brain, different parts of your body, and we'll get a little bit more into this in a little bit, actually. So next, the history of battlefield acupuncture. So a Air Force soldier, Dr. Richard Niemtsau, developed this technique as a low-risk treatment to help soldiers who were suffering from chronic pain. So he wanted to develop this pain-relieving technique that could be used out on the battlefield. So it needs to be quick acting, it needs to be low cost, and it needs to not require a whole lot of preparation because we're kind of quick and dirty on the battlefield, right? We don't have time to set things up and get all fancy. And he really developed it because he saw all these soldiers coming back from different parts of the world and complaining of pain that they didn't really understand why it was happening and they had no way to fix. And they'd been experiencing this for 3, 4, 5 months, even years. So he and others who have been involved with research in battlefield acupuncture are suggesting the use of this for many different types of pain. And it's kind of a more recent topic in literature, more over the past 10 to 15 years. So its implications are still being used to figure out what we might be able to use it for. So many studies have shown success with BFA, but more widespread use of research and things like that are needed before we can actually prescribe this to a lot of people. There's not really any side effects, but the problem is that we don't understand exactly how it works and we don't understand exactly how useful it is yet. So a lot more studies are needed before we can actually kind of bring this out to the more broad population. So first, I just mentioned that we're treating chronic pain with this type of treatment. So I need to describe to you guys what central sensitization is. Now, this is defined as a condition of the nervous system that is associated with the development and maintenance of chronic pain. Now, the central nervous system is composed of the brain and the spinal cord, whereas your peripheral nervous system is all of the nerves that come off of that and go to your extremities and different parts of your body. So the problem with central sensitization is that even after the tissue damage goes away, some people continue to experience pain. And the reason behind this is that your spinal cord and your brain actually transmit messages depending on the type of stimulus that's being performed. And the brain can begin to perceive these messages in ways other than they were intended to do. So the main purpose of pain, we know, is to warn you that there's tissue damage in your body, and it's actually a protective function so that you don't continue to damage that tissue, which it's a good thing in that sense. But with chronic pain and central sensitization. That pain is still there even after the tissues are no longer being damaged. And at that point, it's just disabling you, causing you to not enjoy the things that you love doing. So we need to fix that. And with that being said, things that don't normally cause you pain might be painful. So you might just rub your clothes on something and it really hurts. Somebody might bump into you and it hurts. These didn't normally hurt you, but then you had this incident and it's maybe years after that's happened and it's still causing you pain. This might be hard to process, but that's perfectly understandable at this point. Also, everyone's brain processes these signals differently. So battlefield acupuncture might not work for you, but it might work for your best friend. It's kind of this way for a lot of treatments for chronic pain, which is why we actually have a big multitude of things that we can try for this sort of issue. So finally, how's BFA performed? So first, the ear is sterilized with an alcohol pad, of course, because we don't want to introduce any bacteria through any wounds in your body and cause more problems. Secondly, the tiny one-time use gold-plated steel needles are inserted into a specific sequence into points throughout your ear. So these points need to be specifically followed because that's how everything's done in the literature, and that's how we know this can work at times. So the first 2 points are down here, the third point is up here, and the other 2 are down here, which is not important for you to memorize, just kind of trying to prove a point. Once these needles are placed in your ear, you don't have to do anything else, which is cool, right? You don't have to come back into the clinic and get them taken out because they followed on their own in 3 to 4 days. They're really small, most people won't even know they're there, and they fall out, which makes this a relatively non-invasive treatment. So also before giving you this treatment, your doctor or physical therapist, whoever is giving this to you, is going to measure your pain levels to check down the road to see how effective the treatment is for you. So that if before the treatment you're experiencing pain that's say 5 out of 10 at worst, and we give you this treatment and 3 weeks later, you might not think it's worked that much, but then when we ask you, you're like, wow, my pain is actually more like a 2 or 3, then we know we should probably continue doing this treatment. So onto the next slide, which you guys would ideally have. How does BFA work? Unfortunately, the methods by which, it's kind of the big problem with battlefield acupuncture actually, we don't really understand exactly how it's working. Now we have studies that show that pain levels can decrease and patients typically enjoy this treatment. We don't know exactly how it works, which has kind of been the case through acupuncture all throughout history. So I have 3 theories for you guys. The first theory is that the insertion of the needle into specific spots in your ear can actually stimulate the brain, which then stimulates endorphins or serotonin into your bloodstream. Now, neurotransmitters are signals transmitted by your nerves, obviously, that can go to different parts of your body and impact different features. So they might relieve pain, they might make you feel a certain way, they might tell your organs to do something or your muscles to do something. They can do all kinds of things. So serotonin regulates mood and emotion. So in chronic pain, depression, obviously, and anxiety can be big contributors. So the uptake of serotonin would be important. So if that's what BFA is doing and we find that out, obviously this will be an important treatment. Also, endorphins can be released, which is the neurotransmitter that's responsible for modulating pain and reducing your perception of pain. A second theory. Ancient Chinese medicine claims that there are energy pathways throughout the body. Now this one's a little bit harder to imagine, but this has kind of been the concept for acupuncture since it was created. So there's these energy pathways throughout the body, and then if you put these needles into the acupoints, the flow of this energy will self-correct. So say the pathways are generally flowing one way, inserting this needle into that pathway might redirect the flow and normalize it. Now it's not really backed in science, unfortunately, which is why this theory is kind of hard to believe. But acupuncture has been used for hundreds, thousands of years throughout history, and this has been the backing for it. Finally, some people believe that peripheral nerves are stimulated by the shallow needles, and then the axons coming off the nerve can actually transmit other signals, and that can help modulate the pain. So how is battlefield acupuncture currently used? So currently, to the best of my research, battlefield acupuncture is utilized solely by the military still, but the Department of Defense is studying it and using it in many healthcare clinics around the world. However, if you're going to use this, training and certification is necessary to utilize this treatment. So first, the practitioners who can use this treatment are physical therapists, physicians, APRNs, which are advanced practice registered nurses, and physician's assistants. They're all eligible to receive this type of training. So say you read some research on it and you're really invested in it, and you typically work maybe at a VA or somewhere in the military where you could actually implement this technique, then you might want to go get specialized in it and just see if you can implement it and help your patients better. It's kind of like a tool in a toolkit. So we have different modalities such as like electrical stimulation, even like ice and heater modalities. This could be another one that you throw in for people that the other ones don't work for, perhaps. Many different problems are treated with battlefield acupuncture today and are being studied for use in this treatment, such as migraines, back pain, anxiety, and numerous other musculoskeletal conditions. So by musculoskeletal conditions, I just mean any pain or symptoms that can result from past or current damage to muscles and bones within your body. Now you might be wondering, if there's not the best research on it, why should I try battlefield acupuncture? Well, I have 3 different ways here that might change your mind a little bit on that. All right, first, so battlefield acupuncture is a relatively low cost, so it's just 5 tiny needles per side of the ear. It's non-invasive, so the needles just go part of the way in, they're really tiny, and then they fall out. And they are very well tolerated. Typically, patients don't report any pain, numbness, anything like that within their ear, so that's a great sign. Also, it's relatively low maintenance. So you leave all your clothes on, you just get quickly sterilized, and then you only need 1 trip to the clinic for each treatment. So 2 to 10 weeks is commonly the suggested time frame for treatment. And then after this, most studies are reporting that you actually might see a decrease in pain for 3 or 4 weeks, even months after this. Now finally, our last goal for this presentation was for you to understand why alternative pain relieving methods are needed. So I'm sure you guys know the prescription of opioids by physicians in the United States has greatly risen in the past few decades. So if you've heard of the Choose PT movement, that's choosing physical therapy over opioids for pain relief. This is just another technique that one might choose because there's no side effects, no possible chance for addiction, and it's just worth trying. There's no reason not to, really, in that sense. So chronic pain is very common and can be very hard to treat because, as discussed earlier, everybody's is different and we're not sure the exact origin of it a lot of times. Back pain affects more than 80% of Americans at some point in their life and can cause individuals to miss work or even become disabled. One source cited that in the United States, back pain is the 2nd most common cause of disability. And that's back pain, not a specific back injury or pathology. In 2016, over 20% of adults in America experienced a type of chronic pain. Sometimes other treatments such as physical therapy, chiropractic care, and surgery just do not provide enough relief for this chronic pain. So it's important for us to find other techniques that might be worth trying. And finally, in one study of 2,500 soldiers serving in Iraq and Afghanistan, almost half, once they came back to America, reported pain for 3 months after service, and a quarter of these soldiers reported pain for more than a year after service. So if we're going to do the best that we can to support those who serve our country, then low maintenance, low cost strategies such as this might be just enough to get them by and get them over the hump and get them back to enjoying life as usual. So I hope this presentation helped you understand the use of battlefield acupuncture and why it, although it's not the most backed by research currently, why it just might be worth giving a try. So I hope you guys have a good week, and thank you for coming to my TED Talk.